Hi, and welcome to a conversation on telehealth with the AMA. My name is Dan Seals, and today I'm joined by Laurie McGraw, Senior Vice President of Health Solutions at the AMA, and Meg Barron, Vice President of Digital Health Innovations, also at the AMA. Welcome to you both.
Thanks, Dan.
Thank you.
Laurie, I'd like to start with you and really with a blunt question. What does the AMA have to do with telehealth?
Well, the AMA cares a lot about telehealth, Dan. So first of all, the AMA has been working on telehealth because it's excellent innovation that wants to get into and across healthcare for a long time. And that was a lot of focus on issues like payment, coding, coverage, things of that nature pre-pandemic. And then, as everybody knows, with the pandemic, telehealth absolutely exploded as the primary way for most people to get access to care. So the AMA has been very focused on policy issues, payment and coverage issues, on guides and resources to ensure that this can be brought into workflows, which is so important, so that there's access for patients, so there's the ability to address things like health inequities and things of that nature. So those are just some of the reasons why the AMA is so heavily involved in telehealth.
Meg, let me ask you. So there's a lot that's built into telehealth, and it's still new to a lot of folks in the country, but how do physicians and practices really know if it's working? How do they quantify the effect of telehealth?
Yeah, great question, Dan. As we really continue to shift towards digitally enabled care, it's going to be critical to really have a framework to better guide the industry in assessing value comprehensively. So to this end, AMA's worked with industry leaders to develop what we've called a return on health virtual care framework. And the goal of this is really to move beyond dollars and cents and really purely financial return on virtual care, and instead to think more holistically about how value is being created in additional value streams, such as Laurie mentioned, patient access, clinical outcomes, patient access, patient and physician satisfaction, and all of this in additional to just financial outcomes. And as part of this research, we've also been able to highlight how organizations and health systems and practices of all different sizes are already doing this and already seeing results. So we have various case studies featured in the research as well.
Laurie, one of the things that the AMA provides is CPT, the current procedural terminology. How does CPT factor in supporting telehealth?
Yeah, so AMA does a lot of research, as Meg just mentioned. And so in some of the research in terms of what physicians care about most when it comes to innovation, and we think of telehealth and digital therapeutics and digital medicine as a lot of innovation coming into healthcare, they care about four things. Does it work? Will I get paid? Am I liable? How do I integrate it into my workflows? So Meg's talking about how do we value telehealth, but CPT supports the path to payment, the coding, the coverage, and the path to payment as the terminology for all medical services and procedures. So the AMA and CPT, the editorial panel, independent body, has been working on the appropriate codes that describe telehealth, augmented intelligence, digital therapeutics, things of that nature. We also quickly learned back in, about half a dozen years ago that codes alone were not enough to get to that adoption of telehealth and all the innovations with digital medicine. So we convened a group, the Digital Medicine Payment Advisory Group, to work on not just what are the right codes to describe all of these different innovations, but also how do we work on issues of coverage, payment, program integrity, so that whether it's telehealth or digital medicine more broadly can be well adopted across healthcare. Again, providing access, providing coverage, providing payment, but also really addressing some very important conditions that patients have, chronic care and others.
So Laurie, let me stay with you. So I think in the CPT world, I'm hearing that there is a digital taxonomy. Is that something that's about to happen?
Yeah, so digital taxonomy is a part of CPT. This was an appendix, which is actually just an ability to describe specifically all of the terms that describe digital medicine. And again, this is a field that is exploding. So we have things like telehealth visits, e-visits, internet consults, remote patient monitoring, self-measured blood pressure monitoring, things of that nature. How you describe those innovations specifically will lead to how do we code for them? How are they covered and paid for, whether they're by insurers or within the different companies that they're within. So the digital taxonomy is a part of CPT, and innovators, digital health technology companies should be using it to describe their actual innovations, again, to lead to that pathway to payment.
Meg, let me turn back to you. We've been talking about physicians, we've been talking about CPT. What about the patients? What about consumers? Where do they factor in? How are they going to influence telehealth?
Yeah, absolutely. I mean, patients are and will be essential for guiding the future of telehealth. And again, back to research, based on recent research we have done and the industry has done, we know patients overwhelmingly want telehealth and the convenience of virtual care to continue as an option. And we also know just the world and really expectations have changed. So the goal is to continue to really progress versus regress as we move again towards digitally enabled care, which is a blend of in-person and virtual. And the end goal is how can we focus on the right care at the right time and the right modality of care to best really meet patient needs and to let patients and physicians really guide these decisions. I'd say the other thing in this vein is it's essential that historically marginalized patients and innovators are engaged early and often, because the opportunity here is that telehealth is leveraged to really expand access to care and to meet the needs of all patients, not just the patients that have access right now to that technology.
Last question. You mentioned research and some of the work that still needs to be done. What are the areas that still need to be researched? What do we still need to understand about telehealth?
Yeah, there's been so much progress, right? Like so quickly. And at this point, it's how do we take a breath and really think through what are these best practices that are starting to really get assembled. So we're working with practices across the country to really look at how do we optimize and sustain the progress to date. And again, I keep mentioning this move towards digitally enabled care, but we think that is so important. And we also recognize there are opportunities to really deep dive into areas around clinical impact by specialty, impact on total cost of care, impact on health equity, and even back to that return on health framework that I was mentioning again. How do we move beyond dollars and cents for quantifying the value of virtual care, but think more comprehensively on both the short and long-term impacts and overall opportunity that virtual care is creating for the industry.
That's Meg Barron, Vice President for Digital Health Innovations at the AMA, and Laurie McGraw, Senior Vice President, Health Solutions at the AMA. Thank you so much for joining us. If viewers want to get more information, you can visit the AMA website. That's at www.ama-assn.org. My name is Dan Seals. Thank you for joining us.
Thanks, Dan.
Thanks, Dan.